I'm Dr. Troy Spurl, and our podcast is Synapse Snips. Our podcast teaches people about how the body is supposed to work, basically how we were innately made. Have you ever wondered why you get headaches? Ever wondered why you wake up and your feet don't work in the morning and they're achy, and then as you get walking, it gets better? Have you ever wondered why you don't remember your dreams? Have you ever wondered why you're gaining weight even though you're eating right, you're exercising, and the weight keeps coming on? Have you ever wondered why you're just feeling depressed? It's hard to get up off the couch. If you ever wondered about why you feel these things and why you're not just feeling right, listen to our podcast to get the answers. We get to the root cause and we tell you why. Make sure you're listening to Synapse Snips each and every week, where we answer the questions that you guys have. Also, you can find us at officialsynapse.com. That's official synapse, synapse.com. Hey, there's Dr. Troy with Dr. Amber, Dr. Ellie, and Rochelle. Today, we've got a treat for you. We are going to be talking about hormones. This is going to be one of the few times where you rarely hear from me. I'm going to be asking the questions and let the experts start talking about it. So Dr. Amber, Dr. Ellie, and Rochelle, generally speaking, are the ones we will look to when we're in our meetings every morning and we start asking questions about hormones. So I know Dr. Ellie works in particular with PCOS and a lot of other hormone issues in that realm, and we've got some other podcasts there. Dr. Amber's been working with female hormones as well as a lot of the neurology. She does a lot of things, actually, so we can't go through her whole list. This is only a 30-minute podcast. And then Rochelle is our hormone specialist. So let's just start out of the gates and just talk a little bit about, and we'll start with you, Dr. Ellie, a little bit of the importance of hormones, especially from youth, and then take it from there.
Yeah, so hormones play a huge role in basically all of our organ systems. A lot of times when you think of hormones, you just think of like, oh, when you are menstruating, then you have a lot of hormones, or, hormones called PMS. And that is true, but every organ in our system actually has hormone receptors. So hormones impact every part of our life. And in particular, really a lot of our emotional component. We'll be talking about that more today too. But hormones overall really can make you feel amazing or make you feel like you're kind of losing your mind. So we'll be talking a little bit about that, on how to make sure that you feel balanced overall and how to know if your hormones are out of line too.
Yeah, so Dr. Amber, what's the first thing you think of when it comes to hormones? What's the first thing that pops in your mind?
Kind of feeding off what Ellie said, it's amazing on the areas that it touches. And the more I dived into it over the last 5 years that I have been, still things are coming up like, oh, I didn't realize that it regulates this. I didn't realize that it affects this. I mean, even from the amygdala stabilization and things like the inner ear with vestibular health, gut health, immune system, cognitive functioning. I mean, it's everywhere. So I'd say that's what comes to mind, is like how important and amazing they are, and how we put some focus on it, but not, I think, what it deserves.
Yeah, and functional medicine, hormones are another communication system. And in functional medicine, a breakdown in communication leads to dysfunction, hence functional medicine. So that's the area we're kind of working with there. Now, Rochelle comes from the traditional model, and she's been a blessing to our group here because she approaches it from the traditional world as well. So tell us a little bit about what your perspective of hormones is.
Yeah, thank you. So when I was going through traditional medicine and practicing in hospital world, I had no knowledge. So it was zero. And then you jumped out and I went into this functional medicine world, and I realized a huge component of our foundations to the pillar of health was missing in the conversation, like you just said, Troy, in the communication of our systems to build back better, to support, to rectify. And a lot of that, and just to clarify, we're talking about the sex hormones right now, right? Everybody, so estradiol, testosterone, progesterone, because there's a lot of hormones in the body, but we're dialing in on the sex ones particularly. So there are things I didn't know that I wish I had known. When you give testosterone injections, for example, it can increase your red blood cell volume and numbers of red blood cells. And some ER docs actually use that as a circumventing way to help people who have renal failure get more of that red blood cell volume so they don't go into volume overload. I wish I'd known that, because that's simple, that's cheap, and that would be a lot more fun to stick somebody with something real quick and get them out the door versus put them on something like Procrit, which is thousands of dollars and, keeps you in the mixture of being sick and ill. So it's a very interesting segue here that we all kind of intertwine with. And I just so appreciate everybody's unique approaches, because there's a lot to learn and there's a lot of reintegrative things that we can play with to get people well.
Yeah, on that note too, Dr. Amber, can you comment on just how it's been having Rochelle come in, so that now we've got both worlds talking together and working together? Because when we were doing things just functionally, we had results, but there's a missing part that Rochelle comes in, and she's made our lives a lot easier. But I want you to speak to that if you can.
Yeah, I actually started diving into hormones during COVID when we were off for a couple of weeks. I'm like, we don't have enough hormone support here at the office. And so I started diving in, and it kind of grew from there. And for years, yes, we've been doing the Dutch test and really helping people with, supportive help with herbs and lifestyle and ways to help it, but it wasn't showing the results when women are actually in that hormone dropping stage. And so I was wanting someone to come on for a long time. I was referring people out, and then we finally got someone who's doing it, Rochelle, and I'm so excited to then also be able to have it in-house where we can communicate so easily with that. And so I know we kind of talked about this, but pairing the two together it's so fantastic, because from a functional medicine standpoint, we can do things like the Dutch test, which is a urine metabolite test, and it shows things a little bit differently than serum tests. And so it shows things like detox pathways and different levels that gives us so much information how we can support those hormone detoxification pathways. So when Rochelle puts people on hormones, and I know either genetically or lifestyle wise why they're going down certain detox pathways, I can support her raising those estrogen levels, those progesterone levels, and support that healthy detoxification so we don't get it back up in those systems. And so that's where it gets really cool, where we can pair it together. And then we can also look at other things in the functional medicine to support that traditional medicine is looking at gut health, looking for things like increased beta glucuronidase in the gut that can affect estrogen metabolism and cause you to have a relative estrogen dominance. Or things like looking at your genetic pathways for gene mutations or genetic SNPs that can affect your ability to detoxify. Also looking at something called the total tox burden test to look at if you have toxins that can stimulate the estrogen receptors and again give you that relative estrogen dominance. That's something that wouldn't be shown on a blood serum test or a Dutch test. That we can look at and see if we can support that balancing of the hormones. And so that's why it's so great to just have both together, because you can get so much better results from the bioidentical hormone replacement therapy with the functional medicine paired with it.
So I know it's mostly women that are going to be watching this podcast, but for the two guys that are watching right now, I want to say it a different way. It's like having a toolbox with screwdrivers and both in the same toolbox. So you have everything you can work with. And this is for the women I know that are out there that are very hesitant to do any type of hormone, taking on hormones themselves. We found in functional medicine, yes, when you restore a lot of the foundational things can start working better. But some women are so deficient that they can never breach that threshold to actually get their head above water to actually make things work. So having the hormones on board at the same time allows like almost an instantaneous, I feel better. Therefore, I can now do the things you're asking me to do in a functional way. The compliance is through the roof that I've seen. So you mentioned the Dutch test. I'm going to actually bring that up on my screen here and share it. And Ellie, I know you used the Dutch test, so I'm going to have you comment on that first, just a little bit here when it comes to what we're looking at. So there's the Dutch test here.
So overall, as you guys can see, and those who are on the podcast, I'll try to explain it as well as I can. But we're looking at estradiol, progesterone, testosterone, and then some of the broken down components of the testosterone. So we have that alpha, 5-alpha, and aldosterone. And then as we go down, we start to see it broken down into more numbers, kind of give us those really good specifics. And then we get to see how those hormones are broken down. Now, this page I really appreciate because this is where we get into that juicy stuff of seeing how the hormones are broken down into each different level. My favorite part, if I had to choose a favorite part of my labs, is that estrogen component where it's broken down. So we have the E1, 2, and 3. Now, those are different types of estrogens. E1 is our protective estrogen. We like having a lot of E1. That one makes you feel really good. The one that we don't necessarily like to have a lot of is that E3. That one is more associated with increased risk of breast cancer or endometriosis, fibroids, kind of the negative factors of estrogens. That's when we start to see. Now, when we keep on looking down, we can see that we have that 2-OH, 4-OH, and 16-OH pathway. That is how those estrogens are broken down into. Now, that 16-OH that Dr. Troy just highlighted is kind of that negative pathway that we see. If those E3 goes down into that 16-OH, again, we're having that negative factor of estrogens that we don't really like. We really like to see that 2-OH being nice and high. And then in the very end, we see that methylation component. In this particular patient, it's a little lower. And so Dr. Amber and I have a lot of different techniques to make sure that your estrogen is being broken down properly in all of those different steps, and to move it from those not so good estrogens and not so good pathways into those positive pathways where you really start to see those impacts. So in the blood serum, it can look like you have normal amounts of estrogen, but with this Dutch test, we're able to see how they're broken down and how you're able to detox them.
Yeah, one of the things early in my career that we were looking at, we would take blood, urine, and saliva, and they would give us more insight into how the body is working as far as what is being transported in the blood, what is actually being used in the cell, that's the saliva, and then what's being excreted or metabolized out properly through the urine. This is the same thing. So when we do the hormones through the blood and then through this process, one of my favorite parts too is the methylation activity scale and the actual detoxification. So Dr. Amber, I know you've put a lot of work into this type of area. Could you speak to also just the methylation and the glutathione detox part of it when it comes to hormones?
Yeah, I'll just bring up my own example here that we can talk about. So when I run my own Dutch test, my 16-OH pathway is super elevated. And I didn't know this. And guess what's in my history? History of fibroids. I've had multiple surgeries to remove fibroids. And I think if I would have known this in my past, it's probably genetic. My mom had fibroids as well. I could have supported that detoxification with things like DIM to try and shift me over into that 2-OH pathway. And I've started actually my own bioidentical hormone replacement therapy journey with Rochelle. And I've just started. And for me, I've been noticing a little bit increase in breast tenderness and actually a little bit of water retention. And I bet you, and I'm going to start working on this, it's because I favor that 16-OH pathway. And so I need to increase my cruciferous vegetables, increase my fiber, just to support that pathway so I can gain the benefits of the hormones without having those negative effects. And that's where it's nice to have these two paired together so I can troubleshoot, like, okay, why is this happening? Well, it's because my 16-OH pathway is increased either for reasons, either lifestyle, exposure, or genetics. And so, yeah, that's where the benefits come in. And just like Dr. Ellie was talking, that 4-OH, that's the one that's a little bit more DNA damaging, and it can cause things like cancer. So if we see that, we're going to start increasing things like glutathione or resveratrol to try and bring that down. And so it's just another wonderful way to support the system as we start to make some changes in it.
Yeah. So as we were talking before coming live here, we were talking about what we're going to be discussing, everything. And I just wanted to show people how we actually speak about this problem solving thing. And something you said there was so crucial. You said the word journey, hormone journey. I want women to hear that, because women a lot of times will say, what do I take for this? And I just want to show you something here. I'm going to reshare my screen in a second onto a different little provider resource. This is actually the flow chart of a lot of our decision making that we have to go through to make decisions on what you need. And so each of these has a little number beside it. And then you can see here, if you want to push cortisone or push cortisol, there are multiple things, 6 to 8 different things that can actually be influenced with that. And this is not everything. So the decision making is very, very much a process. But I've also seen when we get it right and things are in balance, then women feel much better. And Rochelle likes the labs that are there. So how do you speak to that a little bit? Like, what would you say with what Dr. Amber just brought up with her particular awareness of some of the changes that are happening based on what she implemented? From your perspective, what would you do?
Sure. So I always, whenever I start somebody on modalities and therapies that are prescriptions, want to retest levels to see what's going on. And someone like Amber, if it's okay to disclose, who's not postmenopausal, that the numbers in a blood serum concentration are going to be specific to where you are in your cycle, because your estradiol when you're bleeding and menstruating will be low versus when you're ovulating, it'll be peak performance. So we take that into account. The Dutch testing can be helpful because it gives a more comprehensive oversight or a secondary data point. And so we can look into a little bit more of a full story if we have it on hand. So with Amber's particular, side effect per se, I would wonder about the ratio of balance of estradiol to progesterone. I would wonder if we're having maybe cream sensitivity, if we were using a cream, and if we need to change the formulary of the base of that cream, because there are different deliveries that we can apply. I would then also just look into, well, those would be the first two things that I would start with. Where are the levels at? And then what am I using from a product standpoint that could be influencing you in a negative way? In addition to Amber's expertise about how that is metabolizing uniquely, which is really interesting because it's not something that we're, with the WorldLink medical community that I'm a part of, we're not trained on Dutch testing, to be frank. And so it's not something that we use in our day-to-day decision making. So coming into Synapse, I've had that extra benefit, I guess I could say, of looking into things like that and seeing what else new can we create to help people with their hormones get well. Also, just a tangent, but some hormones and their delivery vehicles, like if you use a testosterone cream versus a testosterone injection, the cream will use the liver to process and metabolize it. The injection will not. And so working with providers like you guys who know how to help detox the liver or prep the liver so that it can be very well functioning to handle hormones is very relevant.
Yeah, and what I want people to
I do
hear.
kind of want to just
Go ahead,
amplify one thing with Rochelle, the fact that she tests a couple of times for your bioidenticals is very rare. I have been trying to go out and network with a bunch of OBGYNs or different providers that give it, and they just kind of give a standard cream that has this amount of estrogen, this amount of progesterone, and we hope that it works for you. Rochelle is so intentional and so mindful of breaking each one down, knowing which one will work, and then changing it if it's not working for you. And so that is exceptional care. I haven't found anyone who gives as such thought into your care as you do.
Stop. Exactly what I was going to talk about, because that is one of the keys. So one of the things you all just said there is it's a journey, it's a process. And as you actually are fixing one thing, getting the right dosages is very important. So retesting is crucial. And that includes whether it's the depth of the blood test or even just doing questionnaires or doing check-ins. It's not, here's something for your hormones, see you in 6 months. It's let's get something introduced, knowing we're improving the communication system. And then when that improves, there's going to be a little area that is going to be a deficit, if you will. And so once you actually can kind of fill the cracks like that, which is what functional medicine does as well. So even though Rochelle came from the nutritional world, she's behaving like a functional medicine practitioner when it comes to getting it right and looking at all the different things. But she just has more tools in her toolbox now to actually work with the functional medicine thing because of Dr. Amber, because of Dr. Ellie and the work they're doing. So I absolutely love the process, but I really want people to hear you've got to keep working, keep retesting. And then when you get it right, boy, there's a rhythm of life that just happens that you can just start to live. And we call it thriving versus just like your head's just barely above water. We want people to start thriving in life because we believe each and every one of you have a gift. And when your health's not there, it's hard for you to operate out of your gift, right? So let's give a nugget. You go ahead and say something, Amber.
Dr. Troy, I would like to say though, just to props, because I talked about some of my, side effects, is the amazing benefits that I personally have gained, and so many other patients. I mean, sleep is probably the number one and the most important that a lot of my patients get benefits from. I mean, it's night and day with the support. Also, my ability to like work out, running longer distances, having the desire to run longer distances because it doesn't hurt as much. My body aches and pains are better. You know, there's less pain. And then, I mean, just not to get too personal, but libido, big, huge improvement with that. That's another one. I mean, I've thrown herbs
You
at
guys
people.
just checked in.
Yeah.
Yeah.
I've thrown at herbs that are supposed to help libido at so many patients without huge improvements, really any improvement. And so to have something that actually helps women in this stage of life is just huge. And so yeah, I just want to give that amazing feedback too.
I'm really happy you said that. So one thing we need to clear up, Rochelle, has to do with the guys. I was being interviewed on the radio, and I was asked about testosterone. And my comment was, we should never, as men, have lower testosterone. It's stress that eats testosterone, meaning mental, chemical, and physical stress and distress is what lowers your testosterone. We were never made to actually lose it. Some people heard that as don't take testosterone. And that's not what I'm saying. So I'm saying that if we were in a perfect world with no mental, chemical, or physical stress, we wouldn't need testosterone replacement. But that's not the world we live in. I'm not sure, but if you check, it'd be pretty stressful at times right now. So can you speak to that, Rochelle, as far as the need for men in particular, for men and women, but men in particular for testosterone?
Yeah, I think we give a lot of credence to menopause and perimenopause and the transition on the female end. And, you know, we say the male equivalent of that can be andropause in some sense of a word, if we need to term it, although it just doesn't sound sexy or cool. So we don't say it a lot. But, you know, it's sometimes there's less fuel in the tank when you take the car out. And that's because of, you know, toxicities in the environment like glyphosate. That's because just as we do age, we lose a little bit of our receptors. We don't have a clean diet, a good healthy liver, and that type of function. Sometimes it's our dietary influences. There's a wide repertoire as to why things can deplete themselves over time. And so I just want to give respect to that because there can be males out there that don't feel themselves. Just this week, I had like a mid-30s-year-old patient who says, you know, I'm a pro XYZ player, and all of a sudden I'm not able to throw the free throws. I'm not able to run the ultra marathons. And I just assume that's normal. I said, no, it's not, right? And so for males, testosterone can be very relevant. It can be very applicable. You really set your hormonal appetite and pedigree for your hormones that your body is going to want to sustain itself with when you go through the later years of puberty, so your teenage years and your early college years. And so it's important to know who you were at that season of life because that helps us interpret what type of demand you might have for your body throughout your later years. So we get to do things like that with males, and we get to use testosterone creams. We get to use testosterone injections. We also, though, get to use things like HCG, like Clomid, to help your body waken back up and see if it can produce a little bit more when it's given the signals to. So it's not that you're doing it on your own to some degree, but with an added factor into it. But we get to play with a lot of those things that help males feel well too, because there are them out there for sure. And that's just a short snippet, but we could go into more of that if we wanted to.
Well, I'd like to actually ask Dr. Ellie a little bit about the emotional toll of hormones when they're not imbalanced. Tell us a little bit about just the emotional toll of the hormone scenario.
Yeah, so I'll kind of use my own personal experience when it comes to that. After grad school, my hormones were completely wrecked. So I had really low progesterone and really high estrogen. For me, that really caused a lot of anxiety. I would be extremely fatigued, and I just really didn't feel like I could function. Like any little thing would push me over the edge. And I really, people relied on me as a provider, and I need to be able to function better. And one huge part about it is that I felt like I wasn't able to trust God because I would give him up my anxiety, but then it would come right back. So when I worked on my hormones, my anxiety has completely gone down, my fatigue went away, and I felt like I was able to handle so much more, care for my patients at a greater velocity. And then the best part was that it really helped my relationship with God. Now, when I have anxieties, I can give it up to Him and they don't come back. So it's kind of crazy about how hormones really do impact you on a physical, mental, and then spiritual side too.
Yeah, absolutely. And functional medicine is all about restoring the mental, chemical, physical, and spiritual well-being. And this is a personal belief, but I feel like when it comes to our walk with God, our poor health is one of the things that actually impedes that. So I agree with you 100%. I know oxytocin is the love hormone. Rochelle, what is the God hormone?
If we could patent that, we'd be rich.
All right, well said. Okay, one final comment here, and we'll wrap up. But Dr. Amber, if you were to encourage someone when it comes to who thinks they might be struggling with hormones, just a final word on what that overall, how much is meant to your patient base as far as just treating hormones in general.
Yeah, no, it's been a game changer for them. So when patients come in and they tell me their symptoms, sometimes they don't even realize that it can start up to 10 years before you even hit menopause.
Yeah.
And so they're kind of like, well, I'm feeling this way, and they haven't put the dots together that, oh, it's my hormones. And so then we go through the testing to start to see where those hormones are at. And then if there's a problem, we either decide to do it through functional medicine if it's not bad enough yet, or we refer to Rochelle and we either tag team or Rochelle takes the lead on it. And so it's been the missing key for a number of women. So I'm very, very excited to have it on board.
Yeah. Rochelle, same question, just in general. I know this is your niche. It's what you see all the time. Tell us about some of the changes you've seen, or what is a common theme with people that are suffering, and then some of the home runs that you have, or just some of the successes you have with the
Yeah, so I think the bread and butter of the patients that I've been seeing through Synapse clientele have leaned a little bit more on the perimenopause, menopausal, and then andropausal scale. So more in the 40s, 50s, 60s plus. And at that point in life, you've done a lot of good things in the former years, but you still have a lot of vitality to live going forward. And so I think for me, the biggest benefit or gift that I've been able to participate in with people through that journey, because we've been saying it is a journey, is to give them back that sense of their self again. And to allow them to continue to run the miles, to continue to sleep well at night so they can detox and process, to continue to be ready now for the grandkids that are coming up, instead of their own kids that thankfully they don't have to be on duty all the time now. They get to be the fun one. So those are kind of my successes in the sense of I see joint pain go away. I see sleep coming back. I see vaginal health being well lubricated. I see males being able to lift twice as much as they used to in the gym. And so I want to say up to that. I just relish in that because it's just really fun to get people well. And it's simple and it doesn't break the bank. So why not look into it?
Absolutely. And the vitality that comes with it, but doing it with a functional medicine approach, it's just not blindly take this hormone and then deal with the consequences.
Right.
It's truly the way to onboard it. So I'm with you both on that. Dr. Ellie, any final words on just hormone health in general, as men and women are going through from teen years to menopause? What's your final word?
Yeah, so I really like to focus on that, like premenopausal, the cycling women. And it's really fun working with these women because they're able to understand their hormone health for the rest of their life. And so I'm able to get rid of those really bad period cramps or those really bad PMS symptoms. And so that a whole week or 2 weeks out of the month, they're not able to function. And now they're have that back where they are able to function, able to be their true selves throughout their entire cycle. And that is just truly life-changing. And it's really fun to walk beside those women and being able to educate them and let them feel so empowered in their body instead of annoyed by their menstrual cycle. They feel like, oh my gosh, I know how to work with it. I love my body. I'm grateful for the menstrual cycle now.
Yeah, that's awesome. Yeah, learning about your body. It's time for us to go back to school and learn about our body and make good choices for us. We always encourage that here at Synapse, to become educated on what works for you. with Dr. Google, there's so much information out there these days that people have to be careful. It's not all bad, but it's what for you. So that's why this approach has worked very well. Well, I thank you all. I honor you all. You are all amazing women that are helping so many people, and I appreciate you all here at Synapse. So God bless everyone. Thanks for listening, and come check out these wonderful women when it comes to getting your hormones balanced. Bye-bye.
Thank you for listening to the Synapse Nips podcast. If you like what you heard, subscribe to the podcast and share the podcast. To learn more, check out our website at www.officialsynapse.com. Until next time, this has been Synapse Nips podcast. We'll see you on the next episode. This podcast is for information purposes only and should under no circumstances be considered medical advice or a substitute for medical care. Any information given in this podcast is not intended to diagnose or treat any disease and is at the user's own risk. Please first consult a licensed healthcare professional.